Meeting to order for the Monroe County Board of Health. Have two sets of minutes. Actually, the first set is for September 18th, 2025, our regular board meeting. I hope everyone's had a chance to review those. Does anyone have any corrections?
I move that we approve.
I'll second.
Okay, all in favor?
Aye.
Aye.
Aye. Okay, minutes for September 18th, meeting 2025 approved. We also have minutes from October 7th, 2025. That was a special session to talk about job descriptions. Does anyone have any changes to the?
The only one I wanted to bring up for discussion was under number 2, and it talked about that first paragraph, the last sentence. It says discussion included modifying the PHN descriptions to remove the requirement of nursing degree and clarify the requirement for an active Indiana nursing license. We did that, but that degree, removing it was anywhere we wanted to hire an LPN or because they don't, or an LPN because they don't have degrees.
It was
But
just
if it was where you wanted to hire a 4-year nurse, it's okay to leave the degree in.
You removed the degree, didn't you, and just put,
Yes, an active nursing license. Right. I think that would cover both categories, so I don't think we have to specify.
Okay,
As long as it doesn't hamper her ability to decide one or the other. It's very inclusive.
you certainly wouldn't have wanted to hire an LPN for that one, that's. Okay,
Okay, so,
then I'll move we accept it. As
Okay.
written,
Second.
as written.
okay, everyone in favor?
Aye.
Aye. Okay, me. In favor?
Aye. Sorry.
Okay,
Hmm,
approval,
yes.
yes. Okay. Next we have on the agenda, general public comment. And so I want to remind everyone that is for items that are not going to be voted on the agenda. I need to make a clarification. Under E, number 1, the Health Services Director, that's actually a voting item. So if anyone has any items they want to make public comment on that are not on the agenda, please raise your hand online. Do you see anyone who's, no? Okay. Seeing none, and Dave, you are not making public comment?
No, see.
Okay. Okay, next on our agenda is department updates, and we'll hear from Lori. Oh,
so I don't have a whole lot to share today. I think we have a lot of other items we'll be discussing, but a few significant updates. So we have an individual who will be starting on Monday to fill the full-time administrative assistant position. So we've kept this position vacant for a while, actually, just trying to, save some funding and try to redistribute some of those duties. But just to be able to have that position and have some assistance is going to be really great because we all kind of have a lot on our plates right now. Our current medical student completes her rotation tomorrow, and then our next one will be starting on Tuesday next week. So again, these are students through the Indiana University School of Medicine in Indianapolis. They're here for a full month with us and are able to spend time throughout the entire department, working one-on-one with employees, seeing the work that's being done before they start finish their training, their residencies. Applications are being received for the 4th grant-funded disease intervention specialist position. County Council has issued a hiring freeze for all full and part-time positions. I have copies of that here if anyone would like one to see that. So that position, the Health Services Director and the Administrative Assistant were able to move forward with filling those positions if it's before November 1st, from my understanding. If it's after November 1st, my understanding is a request will have to be submitted to then be able to fill any vacant positions, full or part-time. We are going to run out of funding for the methamphetamine program. So those we were going through doing testing and remediation to try to clear that list. But it looks like we're going to have 2 houses that we're not going to be able to have enough funding to do the testing and possible decontamination. But that otherwise, the program has been really pretty successful and have been able to clear a lot of the homes or provide the funding to have them decontaminate.
Do you have a number for the number of homes that were cleared?
I'd have to check with Mike just to give you an accurate.
Those
At
2
this
that are left, what happens then? I mean, do they just condemn them or?
They just stay on the list, so they would have to be tested to see what the levels are. If the levels are safe, then they gets removed from the list. But if it's not, then the homeowner needs to do the decontamination.
Is this one of those things that we do that is regulated? I mean, that we have, it's required that we do it.
No, we have to monitor the list.
So it's at our discretion.
Mhm.
It's not a state required.
For like the core services.
So the homeowner can do the decontamination or hire it done, and then we certify that it's done?
Yeah, we keep track of the list and then we take it, we have our own internal list of all the properties so that we have that for our internal records here.
Okay.
That's all I had.
Okay. Now is Michael online? Is he voting tonight or he's just listening? Michael T.
He is, it looks like
He's
there.
online. He can
Uh-huh.
only vote.
Yep,
because
yep,
the-
I'm on.
Okay,
You can't vote.
he can't vote without video. And I think the email he sent said can't be on video. Is that right?
He's
Yeah,
driving.
I'm in the car. I'm sorry.
Got you. Okay. No, yeah, we want you to be
Can you
safe.
guys hear me?
Yes.
Yeah.
Okay, very good. Yeah, I'm in the car, so just listening.
Okay.
Okay, so we have old and continuing business. So we have the Health Services Director position filled, as Lori alluded to. And the issue is that the gentleman may not or will not have his license. He has his degree, but not his license until possibly December. So so we'll need to vote on that. So I'll let you give them details and then we'll discuss that.
Sure. So an offer for the position of Health Services Director for the candidate was accepted on September 16th of 2025. So in discussions with the candidate, is planning on taking the exam for licensing either the end of November or December. So we were looking at a late December start date for him to complete that. I recently spoke with Dave Schilling about bringing the candidate on sooner before he completes his exam for licensing to allow just additional time to be able to settle into the position, start some of the training, because this position will be assisting and potentially with nursing services and communicable disease. This individual could go ahead and start that training process. And the request is going to be does the board approve of us moving forward with bringing the candidate on prior to him completing his exam? Or wait? Then the second issue is, how is the hiring freeze may impact it, because the candidate will not be starting by November 1st. So I think that it would be really important for Molly to speak to that if she's here.
So there's Molly's with the yellow. Says unverified on the left.
Can you hear me now?
Yes.
Yep.
Okay, sorry, I had to somehow wait. I was waiting to become a presenter. I think the safest thing to do is probably update the county council, because they did provide an exemption for the health services director, but the exemption was set to expire November 1st. So I think they could possibly consider extending the extension depending on when you thought this candidate would start. So I would recommend that Lori send council office an email, explain the situation, and then I can discuss it with county council to see if we can get you an extension, or if we can extend the exemption past November 1st.
Okay. And so should the board still formally vote on that, whether or not to approve bringing the candidate on sooner than our original hire date that we had planned?
I mean, yes, I think if the original plan is going to change, I would recommend that the board go ahead and vote on it contingent on the county council extending the deadline, because I'm sure the council is going to ask, has the board discussed this?
Okay.
Ask a question. So if he takes his exam in November, December, whenever it is, when does he get results?
Mhm.
And do we know if he's licensed or passed?
Oh, sure.
It may be a delay.
Yeah.
We ought to make sure that we extend it out if we're going to ask far enough to include getting the results. And we might have to ask him when he expects to get the results.
I can follow up with them again for that, because I didn't think about that. Of course, the position, his remaining in it would be, he'd have to meet the qualification at some point, but
Right.
yeah, I don't know.
It used to be that your results would come based on how backed up the Health Professions Bureau was. But technically, the machine that you take it on can tell you at that moment whether you pass or fail, but they don't. It has to go through the Bureau because Indiana's licensing you. And so it kind of depends on how backed up they are.
So I would just find out how long that is approximately, so that we ask for enough time.
Okay.
My question would be, has he registered for it yet?
No, because he said he was looking at 2 different dates. He was looking at Terre Haute and a location in Indianapolis.
Hopefully he can get in when he thinks he wants to do it.
I would move that we bring the candidate for Health Services Director position, who has already agreed to join us on board as early as possible, particularly during a training phase up till and unless he gets his license.
But I think he should be limited in what he does, that he should, do the training part,
It would
but
be
not
training,
actual
yeah.
hands-on patient care.
Oh, yes,
And if
definitely.
I-
And really sorry, Molly.
Sorry, if I can jump in, I think I would also recommend talking to Dave, because I'm not so sure we shouldn't have some type of written agreement so that it's clear to the candidate what the expectation is, and that what he's doing prior to passing the exam and what will happen if he doesn't pass the exam. So I would talk to Dave about getting something in writing.
Yeah, well, I think we've done that before, like a memo, and then that goes with their new hire packet and it's signed and everything. So I'll follow up with Dave on that.
So your motion, you said to hire the person as soon as possible. Do we need to make it hire him by November 1st?
The candidate will not, because the candidate needs to would like to provide at least a month to finish out with his current.
Okay, so what should we,
And he's unlicensed. So you really can't let him do any kind of professional duties.
so we need to have the contract first before I make a,
So when I spoke with him, we were looking at the second half of November for a start date.
I left the motion vague because I assumed that there were going to be problems with paperwork and the licensing and so on. So if that needs to be sharpened up somehow, I would be happy to entertain a friendly motion, friendly amendment.
Well, I would agree with onboarding activities, but not professional activities until we have the license in hand, just to protect ourselves and the public.
Okay, so that would mean, and the initial period of his involvement with the department would entail principally training until the license of the appropriate kind was obtained.
I would second that motion.
all in favor? Aye.
Aye.
Motion passes. Thank you, George. Okay, so the next item of business is the 2026 budget discussion. And so I have some updates prepared. So I think maybe I would like to present these updates, and then Molly, definitely we would like you to stay with us until, because we may have some questions for you in trying to move forward. So the first item is that we have been asked, well, we have been asked by council, specifically Dave Henry, our liaison, to have a business plan for the mobile unit. However, the proposed budget at this time is that the monies for the mobile unit will actually be unavailable as they are being moved. The funds have been moved. Is that correct from the budget?
They've been deappropriated.
Deappropriated. So that's item number one. Should we discuss each thing or just, it's kind of all together?
Well, it's up to you. I have comments about this section. You know, having a business plan is definitely appropriate for a business that has an ROI and has to have income and taxes and all that stuff. This is not. This is the department of
Correct.
our facility, and we don't have to make a profit on it. We don't have, what we're doing is public good. And the money we're being allocated for this is for improving the public good. And you can't really measure that in a business plan. So I think it's inappropriate to have a business plan for a mobile unit.
So the other comment I would like to, well, the other item I want on this regarding the mobile unit, because this is in regards to the COVID funds. And so I want to just read a document. This is a memorandum dated January 4th, 2022 from Dr. Christina Box. And this is in regards to the COVID-19 funds. This is a quote. These funds are one-time in nature and are therefore should be used for one-time costs and investment. Therefore, she said several things, that public health nationwide is experiencing unprecedented funding challenges. Therefore, local governments should not use these funds to supplant local budgets. So I'm not sure what to, I don't know, Molly, can you comment on that in terms of what's been suggested with the council's budget?
I think the only comment that I can provide really is I don't know what they really want when they say a business plan. So I wish I could have more insight for you, but I don't know if that means they're concerned about profit, which I don't think they are. I think they're concerned about who's going to be using it, where is it going to be parked, what does all that look like, where are we buying it from, what are we buying. And so I don't really know what details myself they want, and so I can follow up with council to see if I can get you guys more detail, but I don't know what when Mr. Henry says business plan, I know what I think of as a business plan. I don't know if it's the same thing that he's expecting.
Okay, so how can we really facilitate communication, because the vote is October 28th. We're supposed to have this information to him by October 28th. So how do we facilitate this communication? Because
I can send council an email, and I will include board chairs and Lori, and I can do it either tomorrow or first thing Monday, or even maybe tonight, and ask, you've asked the health department for this business plan. If they provide the following details, is that what you're expecting? And see if I can get some guidance from him as early as tomorrow, but I can't promise anything.
Okay,
I think that directive comes from
this is from the state,
the top.
ID Range.
Right. And Dr. Box, and she's saying this is a one-time investment. You need to
Correct.
buy something with that.
Correct.
And we did that. We submitted a request for the van or for the mobile unit. That is exactly what the state's asking us to do. I think we should follow the guidance of the state, and the health department should decide how we use that equipment. And I don't think it's a matter for the county council to decide.
I agree.
Just like they don't tell the fire department how to put out a fire, I don't think they need to tell us how to use a mobile unit. But that's my opinion.
I agree. Okay. So the next item, that actually we were then asked to provide a business plan for the health department. So
Does the budget not?
well, so these are taxpayer dollars that we are trying to run a taxpayer funded department. We are not about making a profit. I mean, certainly if you look at the numbers, I mean, our income annually from the health department is about $500,000. If you look at the budget with our with the proposed changes with the added positions, that's around $2.4 million. And at the last meeting, council suggested that they are going to cut our budget, or intend to cut our budget, by $1.8 million. So we are not a business. We are here to provide health and wellness services, vaccines, safety for the public.
I had a question. I was looking at this budget. There's a line item here for a financial manager. Is that something that we have had in the past?
So it started, yes, as a position. So I'm not sure how long that position had been filled prior to Penny retiring, but it was.
Do we still have a financial manager on board?
Yes.
So is that who the council is referring to, that we need to have our financial manager present a business plan for our department? And do other departments like the fire department have to provide the same thing to the council?
No.
So I wonder why we have to provide that.
I think it's a fair question.
So Molly, how would you advise us in terms of this request for this business plan for the health department?
Again, I'm not sure what the council means when they say a business plan. I don't know if it's something like the parks master plan. Because I mean, parks has a master plan. I can't think of any other departments that do this. We don't, although the council approves the fire department budget, it's not a county department, so it's kind of a weird thing. So I guess I would ask, I can again ask them what they are anticipating the health department providing, because it's one thing for them to say, we want a business plan, but I mean, again, that's kind of a vague request in the sense that what you think of a business plan is probably not going to be what they think of as a business plan. So I would encourage the council to provide you more detail on exactly what they want.
Okay,
Now, do we have a strategic plan like that responds to the things we list on the CHA?
It does need to be updated, our strategic plan.
So we do have that, and we can certainly offer that to the county council and so they can see where we're going in the future. That won't be a business plan, but it will be a spending plan.
We have an annual report which details all the activities of the department.
correct.
I find it hard to understand how that could be interpreted as a business plan, but it is our business.
And the State Board of Accounts, audits our council every year, which is another layer of safety because they're looking for things that don't make sense or don't fit. So that would be another thing that we're already doing.
Correct.
And I will say, I think the business plan request comes in light of the conversation regarding public health nursing and the ending of the IU contract, and whether it's another contract or in-house employees. And so I think some inclusion of how that would look like or be administered from the health department rather than a contract is also kind of what the council is looking for.
Okay.
We can certainly do that.
Speak to that with the request for the positions, the new positions we have asked for, so that we can meet the needs of the public, the needs that were being met by the contract with IU. But that's fraught with landmines, trying to do that in a very quick fashion so that we can provide services. So, but we can provide our thoughts about what our plan going forward should be. The next item we should discuss is that there is a code actually for the HFI funds, and we have to be in compliance with that code. And with the moving of the funds during the last budget meeting, it's really unclear if we're going to be able to meet the criteria that's set out by the state. It's not straightforward because each position is different, meets different criteria for the code. It's complex. So I'm not sure also how we're supposed to maneuver that, Molly. I think because we have to be in compliance with the state in order to maintain our funding. So if council, I'm not sure they are aware of all the nuances of what we're trying to accomplish to maintain the funding. And I know that seems completely unclear, but
I think I would include the HFI code in our communication with the council so that they know that we are between breaking a law, state law, and not getting any funds, and it would put the whole county in.
I've provided the information.
So they have seen the codes, they know that we
to the
are,
liaison.
To the liaison.
they've seen it. Good. I think that
And I
really
think
is.
I think it might be helpful. Is there a particular budget move that you think the council made that makes it likely that you're not going to be able to comply with HFI?
I would say yes, the self-insurance is what I'm most concerned with right now.
Okay, so I don't know that I can speak on the self-insurance because I think that was a whole conversation with the auditor's office and they were following up with the state on it. So I'm not sure what guidance has been requested, received, or shared with council regarding self-insurance and HFI. But
Okay.
I will follow up with the auditor's office and council.
Okay, so the state said their position remains the same, that if it cannot be basically explicitly demonstrated that every dollar is going towards a core service or an employee, that those funds, the self-insurance should not be in the HFI. There is an email and I can send that to you as well.
What about the issue too, where the Health First Indiana funds say that you have to be a citizen of Indiana or a resident of Indiana? But if we have someone, say a homeless person who has tuberculosis, we can't do anything with that person. What do we do? Because it comes from those Health First Indiana funds. We're between a rock and a hard place there.
So we'll definitely have services that we will not be able to provide or people that we will have to deny services. So one of the programs, just as an easy example that we've kind of been dealing with, are the real estate inspections. A lot of those are out of state buyers. So, that's just one example. We will not be able to provide those services for those individuals. The hope is that we can use local county dollars for those communicable disease services. Some of the positions have been moved to grant funding. If that's an option, that's really what we want to look at, but it's going to be challenging. Mm-hmm.
So Lori, are there any of these specific, the ones in green on the budget? Are any of these positions that were moved from 1161 to 1159, are any of these specifically in violation of code? Or is that, it may take a while to investigate that.
So what, with the services, you mean being provided for in 2026?
Yes, for these positions, yes.
So they left 2 food positions in 1159. So our foods division will have flexibility. Essentially, every single person who walks into the health department will have to provide documentation. And then we'll have to determine whether or not we can provide the services. They did move 1 assistant registrar. So again, we use an online platform. A lot of those individuals coming through vital records don't meet that criteria. So we have 1 individual who will be able to receive all of the online requests and address anyone who is not an Indiana resident or does not have documentation. Our other environmental positions, I mean, that's concerning because we don't have any other backup options for the rest of our environmental services that are being provided in the community. There, except for those 2 food inspectors, all of the other environmental positions have been moved back to Health First.
So that is delineated the senior environmental health. Is that what you're referring to?
Yes.
So
all the wastewater sanitarians and our general environmental. So our pool inspections, mosquito trapping, all of the septic wastewater work. So those have all been moved back to Health First.
So
Indiana.
So what I would like to see then is just a memo, that you create a memo saying these positions, because we don't have backup positions that don't have the limitations, that moving those, we would advise against that because of the code that we have to meet.
Yes, so I have requested and I've asked even if we could flip-flop or switch some of them. Even if it was, can you flip-flop one of the foods and move a different environmental, or even the manager who is trained in all of the areas. So if a situation arises, the manager can address and take care of those situations. Unfortunately, that request was denied and I was told that that's just not an option.
So I think we need some sort of a legal statement from our attorney about what do we do when we're between the law, breaking the law, and not getting funding. And especially your point, what do we do when we have a person running around coughing up germs and, TB germs in Kroger who doesn't meet the criteria and therefore we can't treat them? Will the state take care of these people? Indiana is one of the states that has a law against untreated TB patients. You can actually incarcerate them temporarily to begin treatment. Certainly don't want to do that, but we have to protect our community. And I think our lawyer needs to tell us what liability are we at for these unfunded requirements by the state code and for patients who have infectious diseases that we're not allowed to treat. I think we need some sort
Yeah,
of
we need
statement.
the reading of the statutes.
Is there a way to bring this to light before the vote so that council understands, or council with county legal understands the position we're going to be in? And is there an easier way to, or can we request to not cut the budget in X line item because we need that position in order to have public safety?
Yeah, I would say those are non-negotiable line items. If they're required by law, they're not negotiable. And I don't think our county council has the authority to overrule the state of Indiana. So I think they need to respect those codes and help us to not break the law.
Okay, so which positions, again, in the green, would we, what I'd like to do is make a motion that we request council to consider leaving those funds in the, let's see, in the health fund, correct? That's what we're.
1159.
Yeah, 1159. Is that correct?
1159, yes, is where they're at currently.
I mean, we can ask him to testify before the council to show his concern, our concern, and advise us what our liabilities are if we break the law.
I guess maybe if I can, I provided them with a spreadsheet also, taking into consideration that we know that the funding, that, there's these serious funding constraints. So really what I tried to do was even propose, just a backup. You don't have to move everyone, but you have to have at least one person in all of these areas that can fulfill the needs.
That was declined.
Yes.
They declined it. So our lawyer needs to ask what are our options since we've already requested that and it's been declined.
What, Molly has her hand up. I'm so sorry, Molly. Please.
It's okay. I just didn't want to interject. And so, I think county legal is in the same bind that the health department is considering there's no guidance on this legislation. But I'm going to read an email that was sent to Lori from county legal. And I think this may help with environmental, septic, food safety, things of that nature. So it says that we're not going to comment on the legislation, but it's clear that the intent of the legends behind HFI was to use state funds for the benefit of Indiana residents. Without making comment on the legislation, we think using HFI funds for environmental services complies with the reasoning behind the law. Leaking septics or hazardous restaurants are a direct threat to not only the individual who owns them, but to Indiana residents. As much as we'd like to, make it more clear, the problem is IDOH hasn't given us guidance and no one has. So I think to some degree, our thought process was, if someone is reporting a food poisoning case, the health department investigating it is not just for the benefit of the person who may or may not have food poisoning. It's for all Monroe County residents. Making sure restaurants are in compliance with health code is for everyone, not just, one person. So I think that was some of our logic behind, I can't speak to council logic, but that was the legal's thoughts on those environmental, septic, wastewater, all those positions.
Molly, and so it sounded like the last time that I met and spoke with Mike's the director of environmental, that there's the guidance he was provided from legal, again, so similarly to you, what you mentioned, if it's impacting or risking the entire safety of the public, then we should still move forward. But if it's more of those individualized services, such as that align with the core services like the radon testing that we do verify, and if someone can't verify, then we wouldn't go do those extra services because that's just like an add-on individual type service. Is that correct thinking?
I think that was the conversation that was had with Mike. I think the problem is, and it's not a problem, it's some of the hesitation legal has in making or providing advice is, I don't really know what everyone in the health department does, right? So I have an idea of what septic does. I have an idea of what food services do, but it's hard to just say as a whole, I think this is okay, without having a real idea of what services they're providing. So I think if it would be helpful for legal, and I'm saying legal, and roping in Justin Roddy in this, he doesn't know it. It'll be a fun surprise for him. That if we, you could say when we're talking about environmental or septic, this is what we're talking about. We could look at it and try to figure out better whether it needs to be an HFI or if there's another way that we could go about it.
Okay. Thank you. Any other comments on this?
I would just, again, I would say anytime that the county council is picking and choosing which parts of our plan it will fund, it's in effect becoming the county health department because it's making healthcare decisions that should be made by healthcare people like us. And so I just think in general, I understand that they have a financial responsibility to the county to make sure that we're spending the money wisely, but I don't think that they should be micromanaging healthcare decisions. That should be made by the people at this table.
The next item I wanted to bring up is that we have been asked by, and this is in relation to losing the IU Health contract by the end of the year. So we've been asked by October 28th to provide quotes for vendors for services. So those services would include TB surveillance, for instance, those patients who have tuberculosis and they have to be monitored, all the vaccine programs, and all the services that were in the IU Health contract. So I just want to say my opinion is that this is a request that is just bound to ensure that we fail at this juncture. I don't think those vendors there's no vendor. I mean, that's our job. There's no vendor who can really do this in our community. So I'm not sure who that's supposed to be. Aurora had suggested in a memo that maybe we ask other health departments to provide those services temporarily. And I think that gives me great pause.
Plan was to take it in-house, right?
Right. Our plan was to just bring everything in-house, but to do that, we have to have staff. The number one thing we do in health and wellness and what we are doing is staff. I mean, we have to have staff. And so our hands are kind of tied. So healthcare, or rather not healthcare, but public health services is not county highway, is not fire department, is not any other department. We're just really unique. So
Yeah, I think we're not gonna, again, hiring vendors to do this work involves a middleman, and it costs more money
it costs more
to
money
pay the
at the
middleman.
end of the
So
day. And
I'm in favor of us taking it in-house and then being allowed by the county council to hire enough people to staff it, because we just lost, we just lost the staffing we had through the IU Health hospital.
Dr. Teague, I see you have your hand up. Yes.
Yes, thank you. I had a comment and a clarification. I think it's important to note that, every other, county board of health provides these services. We've had that contract with IU Health in Monroe County for a long time, but at this point, we're being asked to basically do what every other county in the state is doing. So I think that's important to remember, and maybe very important to remind the county commission that this is standard of practice for county boards of health throughout the entire state. Secondly, my point of clarification was, if I recall correctly, the proposed positions that we agreed on, I believe last Tuesday, if I recall correctly, that was less expensive than the contract with IU Health. Wasn't that correct?
Yes,
That's
that's
right.
correct.
Yeah, very important to underscore for the county commission that, not only did we, and by we, I mean collectively, work our butts off to come up with a good solution to this problem, we actually saved money in a situation where that is obviously very important for the county. I think we got to underscore those things.
I agree.
The other thing, and just to put it in perspective, the median amount of money spent by local county health departments in the United States is $41 per person per year. The median, the 25th percentile is $23 per person per year. Monroe County is at $8 per person per year. So in one of the lower states, as far as funding, we are low ourselves within just this county. We should be spending about 3 times as much as we're spending just to be at the median. And so I think the perspective of the council is a little skewed by not knowing where we sit. And, we're at the bottom of the bottom as far as healthcare spending and public health. And it needs to be changed.
It's ironic that HFI was supposed to bring us up to that median level.
Right.
And it's vanished like the spring
Yes.
freezes.
And I think it was alluded to earlier, but I don't mean to disdain any other councils, but providing public health to the community is not something that can be done free. Like you have to have funding, and if we're expected to care for folks that have tuberculosis and provide all these vaccinations, those things don't just happen. You have to have the people to do them. So I think Dr. McKinley mentioned earlier, we're not running a business. It ultimately will always be a net negative when you just look at the financials. But the positive is the community investment that's being made by the Board of Health for just general health care for the citizens living there.
I have 2 more items I would like to discuss regarding the budget meetings and updates. So we worked on positions, as Dr. Teague alluded to, and so we'd have the positions and the people in place to provide services by January 1st. And so now we have been told those positions have to go through WIS. And I'm not sure how slow that process is. And so we are, in a time crunch to try to get people or WIS to approve those and then get people hired and get them trained and be ready to go by January 1st. So that's just one of our challenges. And finally, I want to say that, so regarding these highlighted positions in the packets. Oh, I'm so sorry. I missed. Yes, Molly, please.
I wanted to let you guys know I did call WIS and explain to them the time crunch before Tuesday's meeting with the council. And WIS had advised me that they will have a 2-week turnaround from the date that they get them. So hopefully that turnaround will make it, we'll get it back to us so we can start the hiring process.
Okay.
Now,
That would be.
they said that in anticipation that they were going to get them Tuesday. I don't know if we get them later in the holidays, like what that does for that. But as of Tuesday, they said 2 weeks.
So they have everything they need to review.
No, because council tabled.
No, council
did not.
Yeah, council didn't send it to WIS. So once council approves it to go to WIS, WIS is saying 2 weeks.
So it's on the council.
So the vote is for that, or is it on the agenda? How do
It
we,
goes back on the 28th.
the 28th, it's on the agenda for the 28th. Okay. So we would implore, yes. Yes, one moment. We would implore then the council to please address that so that we can move forward and do what we need to do for the citizens of Monroe County. Yes, Dr. Reidebrand.
So what we have to remember is that when we go back on the 28th and we send it to WIS, and if they indeed do send it back in 2 weeks, we still have to go back to council. And the way things have been going with council, it could take, it might happen immediately at the next council meeting, or that once again, they may table us. We could be well into December before they hash out whether or not we can pay individuals. Then we can post. But until they approve the pay and approve the positions, we're still in nowhere land. I will add that I'm at this immunization conference and I have been speaking with people once again from IDOH who are doing what they can to try and support us and are going to be brainstorming how they can help us through this particular stumbling block that we have to getting public health nurses on board. And will be reporting back to me, they promised, at the leadership symposium that I made sure that all of you know about at the end of October. So I just wanted you to know that.
Thank you. And I think Dr. Teague has his hand up again.
Yeah, I have a quick question to consider.
Yes.
I wonder if it is, even if this goes exactly perfectly, the odds of being able to hire these folks, like find the right candidates, get them hired, get them onboarded for a start date of January 1, to me seems very unlikely, even if everything were perfect. I was wondering if it would be possible to approach, whether it be IU Health, whether it be, maybe Morgan County or someone like that, to say, could we get 6 months? I don't know if that would be a possibility of getting it one time, with IU Health. Hey, could we get a 6-month extension because we just do not have enough physical time to do this? Has anything like that been explored, or could we?
Well, not as yet. I think we were hoping to bring it in-house, and part of the challenges with these requests for business plans has been that we really don't have, or quote unquote, a business plan. You know, we don't have really data from IU, from the contract even. We had asked over and over again for data for, you know, what patients were being charged, what money was being brought in, how much was being spent exactly on vaccines, and then how many patients were seen, how many patients' blood pressures were checked. And so, you know, as vice chair, I would be very hesitant to engage in that if we can't get, you know, we don't want to just return to that situation on the one hand. On the other hand, you know, even though this is painful, it would be great if we could actually be successful and bring it in-house and have support of council in terms of, and at this point, it's a budgetary issue at this point, I guess. So that would be my comment, but we have not explored that as yet.
If I can.
Yes, please.
I think my biggest concern with even finding like a someone short term. But now I could see if the council says use a temporary hiring agent, maybe for a contract nurse, but everything that all of the work that has to be set up and established under the health department and trying to do that with another entity just for a short period of time, so much time and effort is addressed in all of those small pieces, the policies, the procedures, the agreements, the, you know, health officer, you know, the license. I mean, it would be a lot of.
Do we ask IU Health to delay their departure 3 or 4 more months so that we don't have to change to another person, and they just keep doing what they're doing for another few months until we can fix this?
We could.
That would be the easiest. We wouldn't have to find somebody else. I think we should ask them if they would delay departure from our clinic until we can get this fixed.
So you would rather do that?
And to go to Morgan County or someplace and start from scratch with them. And they might have different processes than we do here, you know.
And they may be short-staffed also, which I assume most of them are.
I know they've stopped answering our ambulance drivers' calls for help because they've been so inundated with calls from Monroe County that they basically have said, we're not going to do that anymore. So we have leaned on them quite a bit in the last few years.
Morgan
County.
So does someone want to make a motion?
I would make a motion that until we solve this issue with our county council, that we request that IU Health consider continuing their contract with us on a month-to-month basis until we can rearrange our clinic.
Okay, does someone second that?
Well, since it seems like almost the only option at this point, yes, I'll second.
I agree with it, but I also see that might take away some of the hesitancy that the council knows we have to move on.
But we could leave our patients in the lurch.
No, we can't leave patients in.
Right. I agree. We can't let that happen.
Okay, so we'll take a vote. First on the public comment. Oh, yes, I'm sorry. Public comment before we vote. I see no hands. Okay, no hands up for public comment, so we'll take a vote. Lee?
Aye.
Aye.
Can I abstain from voting? Okay. Okay. So the final item I wanted to discuss, so in the highlighted positions in the packet, council, or rather, our liaison is suggesting, I believe, the liaison is suggesting that we approach the state as to how we would fund these positions and try to get funding from the state. Did I misunderstand that? Or maybe I misunderstood that.
I feel, my opinion, I feel as though there are council members or one of the liaisons that feels as though the state really does need to fund for the health department and all of the positions. We can't request directly for them to increase or pay for those because the state just gives us that set amount that they give us, that, which next year will be roughly 814,000.
Didn't they already give us money that was taken away?
Right.
2024, we got zero.
Yeah,
Zero.
Yeah.
We had to use our own accounts.
I mean, to ask them now to give us more, how do they know it won't be taken away again?
I mean, we're in the bottom 10 counties in the state of Indiana as far as how much we value public health, financially speaking. And I think there's room to go up on the portion of the tax levy that we are entitled to. $8 per person is a very, very low number. There are very few other counties that are lower than us.
I think that my most recent, I guess, I think that we have council members who really feel that we should just be using our revenue, what we receive in revenue, for the health fund. So that's roughly around $500,000.
In order to have revenue, you have to have services. We just lost our services.
Right.
So it's kind of a circular thinking.
Right.
Yeah. And I think the public need to probably weigh in on this issue. It's not just for us to decide, but the public. If the public says that indeed we should be in the bottom 10 counties as far as how we support public health, then that's what we should do. But we haven't really heard from the public. And I think that's the next step, is to find out how other people feel about this rather than just us.
I would encourage people the public to be aware of what's going on, and that's part of why we have our meeting publicly, so they know, and to present on the 28th and render an opinion about the state of things for health for Monroe County. I would just, and I don't know if we need to make a motion about this, but I would like to encourage council to consider that we are spending $8 per person, and the national average, you said, Lee, is
41.
41.
It's the median.
Yes.
20. So that tells you where we're at.
Yes.
We're fighting with Mississippi for the bottom
That's
line.
right. Yep.
So the 28th was really important.
Right.
Day. So other discussion.
I have one update. So given these changes and where the council has shifted some of these funds back into the Health First Indiana funding, I think one of the largest challenges for us is that they've placed costs in the Health First Indiana fund that exceed what I'm actually allowed to even submit to the state for approval to use. So currently, we're really trying to figure out how we're going to make things work. We are going to have funding left over from this year, but I can't use that until halfway. I can't submit a budget request to the state to use any of that until we get to the midway point of 2026.
I have a question. Are some of the funds that we have in our account already dedicated towards something that we received from a grant? And so we have to fulfill the grant. So we really don't have use of those funds. They have to be used for what they were sent here for.
Mhm.
And so it's not like a general fund where you can just spend anything. And so I think that's important. We can't break promises. If we've got grant money from somebody, we have to honor what the grant was for.
Mhm.
And that takes away from how much money we have left to spend for general things.
Mhm.
So I think we need to look at the amount of money that we actually have in the general fund that's not already promised, and because that's going to be a smaller number than what we actually have.
In the health fund.
If it's promised to for some specific thing,
Mm.
then we can't really use it for anything we want to. We have to
Right.
use it for what it was intended for.
Mhm.
So if there are funds in there that are designated funds, then we should not count those toward what we have access to.
I think that what I'll end up having to do is submit partial salaries to get us at least through a portion of the year. But that'll have to be balanced with some of our other costs that we have to sustain our services. I mean, we can't just simply submit a budget to pay for employees for 4 months and then there's no services or supplies or, funding for that. So it'll end up having to be just a portion of salaries and then kind of balance that out with whatever funds we need to at least get us to that midway point and then reevaluate and try to submit a second budget.
I did receive from you a line item budget from IU Health for 2023, 2024 for the clinic that we're talking about.
Okay.
So we could use some of that information to get it, kind of estimate what it's going to cost us
Mm-hmm.
to do it in-house.
So you have this, you have the.
She sent me those two. Yeah, she sent me two,
Mm-hmm.
23, 24. So we can use that as a kind of a guideline. It won't be
Oh,
perfect,
okay.
but we could use that as a to guess how
Mhm.
much we're going to have to spend for vaccines. And
That would be helpful.
And that's kind of, I did provide some of those figures to the council just of kind of what we do know. The supplies and the services, I mean, it wasn't as high as some other counties. So.
Any further discussion about the budget? All right. We'll proceed to new business regarding the injury prevention grant application approval. I'll turn that over to Erin.
Oh, sure. So you should have received in your packet, so that just kind of outlines, you can apply for this grant funding. It's not a whole lot of money, but our maternal and child health coordinator did do a small program this year, just focused on drowning prevention, the water safety kits, if you remember that, and some education. So I met and spoke with her, and she would be interested in me applying to see if we could receive a portion of funds to expand some of that programming, or at least to be able to provide funding so that she could do that again, perhaps partner with an agency or provide funding for swim lessons in addition to some of the water safety kits and some education. So with the board, this would be for a board vote that you would either approve that we submitted application to see if we could receive grant funding or not.
I would so move
I'll second.
in submitting an application.
Oh, one moment. I think do we have to have public comment?
Oh.
Public comment before we vote. Okay. All right, seeing none. Okay, yes, please, George.
I would move that we submit an application for the injury prevention grant.
Second.
All in favor? Aye.
I
Okay, and I did miss the item to vote on regarding moving the health services director to fund 8111.
Yes. So as we've been discussing here tonight with the challenges around the new legislation in Indiana residency and lawful presence, if we are able to move forward with, getting this candidate onboarded and hired, I think that it could be in our best interest to try to move that individual out of Health First Indiana funding to this alternative funding source. So this is what is currently funding our 2 emergency preparedness positions. It's funded the school health liaison. This would allow flexibility for that position to be able to provide services to all people in need, which will be really critical, particularly for the clinical aspect.
From Health First Indiana to,
It's the COAG, School Health COAG grant. Mhm.
Oh, okay, so we're moving it from, do you know which, oh, sorry, from the grant.
From Health First. So it would be to move the position out of Health First Indiana to this grant funding source, to give that flexibility.
Does that position meet the requirements of the grant?
Mhm.
Okay.
And the state has given us written approval because that grant term has essentially ended. We met all of the terms, so we have flexibility with using down the remaining balance.
Okay,
I would move that we move that account to, what's the line we're moving it to?
The school health COAG grant.
Wait.
Mhm.
I'll second that motion.
all in favor?
Aye.
Aye. Okay, motion passes. Next item, if there's any further board member comments or comments from our health officer, Dr. Ryderbrand. I think she left. I think she did.
I want to thank Molly for helping us tonight.
Yes, Molly, thank you
Oh.
very much.
Molly, before we, could you just clarify with the health services director? Are we going to run into any issues with not having the persons started before November 1st? You said to just keep council updated, correct?
I would go ahead and send Kim or council office an email and say that you're aware that this position was included in the exemption until November 1st. This is where you are in the hiring process. This is the issue at hand. And it would help if you had an anticipated start date. And then that way they can look at it and decide if they want to extend the extension or extend the deadline for the exemption.
Okay. Perfect.
Thank you, Molly. All right, do I have a motion to adjourn? Oh, yes, Dave.
I know this is out of order, but I think it might be useful to ask the question. The vote that was taken, I understood your vote to be an abstention. Is that
Yeah.
right? And so my question procedurally, and this might be something that Molly Turner King can answer. Is that considered to pass? Do you need a majority of those present and voting, or you need a majority of the membership of the board? Because,
Less than 4.
yeah, that's my question.
I do not know the answer to that. Molly?
What was, well, I'm thinking, so what was the result of the vote?
3 yes votes and 1 abstention.
If I come on camera, am I able to vote? Because I'm in a
You are.
parking lot now. So I can, as soon as I pull into this parking lot, I can vote. I could vote yay. It'll take me 1 minute.
Well,
Okay.
then I think the board would have to reconsider the
Yes.
vote. I do think it's a majority of the board.
Okay.
Yep.
So what we'll need to do is revisit this item. And before we make a motion, we probably need to ask for public comment. No, make motion first
Motion and then comment.
and then public comment. Okay. Lee, do you want to make the motion?
So I would move that we request IU Health to consider extending their contract with us on a month-to-month basis for a reasonable period of time until we can get funding from our county council to proceed with bringing those services in-house.
Okay. Do I have a second?
I'll second.
Then we'll take a vote. Michael, Dr. T,
Aye.
I see you.
Aye.
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 and I abstain. Thank you. Oh, shoot, we were supposed to have public comment before we voted.
Well,
Is there anyone who has their hand up? And online? No, okay, so motion passes.
But it would be good to research the question.
yes.
Yes. Okay, do I have a motion to adjourn?
I so move.
Second.
Motion or adjournment?